Hello, my name is Mackenzie. I will be your nurse today. Can we just start off by you validating your name and date of birth, please? Okay, thank you. So now I am just going to start off by doing a head and neck inspection on you. So I am just going to take a look at your head position. Your head position looks normal, no abnormalities there. While I look at your facial features, they look very symmetric, no asymmetric facial features. Now as I palpate your skull, it's normocephalic, no lumps or depressions found on the skull. Now your scalp and hair, no abnormalities there. It's very symmetric and smooth. So now I am just going to take a listen at your temporal artery. Make sure there are no abnormalities there. Okay, no abnormal sounds in the temporal artery. Now I'm just going to take a look at the joint right here. If you could just open and close your mouth, please. Smooth movement and no limitations. Do you feel any tenderness when I press it here? No? Awesome. So now I'm just going to take a look at your salivary glands. In here, you have adequate salivary glands. No abnormalities there. So now I am just going to ask you to do a couple movements with your neck so I can look at the movement and range of motion of your neck and the muscles in there. So if you could just move your head up. Okay. And could you move your head, your chin to your chest, please? Okay, awesome. So there are your muscles in your neck all looked symmetric when you were moving. Now if you could just move your head back, down, side to side. Okay, your movement is smooth and controlled, so that is very normal, no abnormalities in your range of motion. So now I am going to just look for your hyoid bones and feel your cartilage in here. No abnormal findings in the hyoid or cartilage bones. Now I'm just going to check out your trachea. I feel no tracheal shift, so that is good. So now I'm going to just take a look at your thyroid gland. I am going to push your trachea slightly to the right. And while I feel no enlarged thyroid gland, which is very good. So now I am going to ask you to take a sip of this water, and I'm going to turn you around. Now take a sip of this water, and I'm going to feel when you swallow. Okay, I'm going to move you back. When you swallow, there are no enlarged glands. And then I am going to just check out the glands back in here. And there are no abnormalities or tenderness here. Now I'm just going to check out your lymph nodes in your head. So I'm going to start back here and move forward to behind your ears, in front of your ears, and down your jaw. And I feel no abnormal findings with those glands, no swollen glands or anything. So now I'm going to look in your lymph nodes of your neck. I'm going to start with the anterior chain, moving towards the posterior chain, feeling. And then I'm going to finally locate the supraclavicular nodes. And I am feeling, and I feel no abnormal findings, no swelling, no tenderness. Now I'm going to look at the nodes inside of your elbow. While I'm feeling here, I feel no swollen, no tenderness, So no abnormal findings there. Now I'm going to look at your axillary lymph nodes, which are in your armpit. As I'm palpating for those, I feel no enlarged lymph nodes. Now I am going to check out your inguinal lymph nodes, so I'm going to have to pull out your leg. I'm going to keep the sheet like that, and then I am feeling the inguinal lymph nodes, and there are no abnormalities. The lymph nodes are normal size and not enlarged. Thank you so much for letting me do an assessment on you today. If you need anything, I'm leaving your call light, and don't hesitate to call me. Bye.